people are here. I'm so excited everyone's back for another exciting Elektra Health Cheers with Peers case discussion. I'll reintroduce myself. My name is Jackie Giannelli. I'm Elektra Health's founding nurse practitioner, board certified and nationally certified by the North American Menopause Society. And this is our second case discussion. And, I'm excited that we had such a great response after the first go around of this. You guys are also enthusiastic, and thank you so much also for participating, so enthusiastically, because we really, our hope for this is that it will really be an interactive, fun, supportive environment that is casual. Like you could come again with don't care what you look like just bring yourself straight. A lot of you are on the West Coast, probably coming straight from work. So we're just so happy that you're here. So today I'll get into it in a little bit, but today we are going to be talking, and appropriately so with Anna here again, about more of an integrative approach to the patient in perimenopause and menopause. And so we'll go through, hopefully you guys had a chance to look over the case and the articles for discussion that accompanied that. And I'll briefly go through it. We have, to make it a little easier, we have up on the screen, hopefully you guys can see sort of a synopsis of the case study. But before we do that, very quickly, so today, the first sort of 30 minutes are going to be us talking about the case, discussing, integrative approaches. We are also going to have another special guest joining us, who's an expert in acupuncture and Chinese medicine and hypnosis. So Kathy is her name. I'll introduce her in a moment, but we're excited to be able to learn from Kathy as well. And then once that's done, we will just dive right into Q&A. And that's just an opportunity to literally ask anything about the case, about, things we didn't cover, just, put it all in the chat. If you feel like coming off camera, right now there's about, 17 folks on the call. So certainly, we can come off camera, we can come off mute, we can have a collegiate discussion here. And that would be just fine by me. All right. So that is going to be, take us probably to about 45 to 50 minutes. I promise not to keep you guys too long unless you want to be here longer than that. And to get started again, I introduced myself, but we also have Anna Barbieri here. She is a board certified OBGYN and integrative medicine specialist using an individualized and holistic approach. She supports patients all through the menopause transition with, of course, all the traditional, conventional modalities, but also non-hormonal treatments and other integrative focuses that we'll dive into today. She is on the faculty of Mount Sinai, and she practices in New York City. And then we have Dr. Kathy Casey, who I'm so excited is joining us. Kathy is a doctor of acupuncture and Chinese medicine. She's licensed in New York and Connecticut. She's nationally board certified herbalist, a certified hypnotherapist, and a member of the International Association of Counselors and Therapists. And for 35 years, she's been active in volunteering and training in the therapeutic touch realm, an energy healing modality developed in the 1970s. And she has a special interest in women's reproductive health and menopause and perimenopause, and sees so many patients and helps so many women in her practice. So we are super, super excited to have Kathy with us today. So on that note too, if you guys want to put your names in the chat, tell us where you practice, tell us who you are, tell us what you're excited about. We would love that as well, because we want to get to know each and every one of you. All right. So before we get started, I thought it would be fun, since this is about managing the patient in perimenopause via an integrative approach, for us to just kind of take a quick poll and see how many of you are kind of dealing with this in your own practices. So we're going to throw the poll up. Hi, Kathy. We're going to throw the poll up now. So let me do that. Bear with me, because I am, going to bring it up. So the first poll, and you guys can just go right ahead and answer, and it will kind of live just tell us, where we are with things. But do patients you guys encounter in practice ask you about non-hormonal integrative alternative treatments for the symptoms of menopause and sexual health? So is this something that people are coming to you and saying, tell me about, ashwagandha? And you're like, am I comfortable with this? Or do you kind of shy away from that? Where are we with this? And there is no right or wrong answer, obviously. And yeah, so far we've got 10 answers. And 9 out of 10 of them are, yes, either I get asked and I'm comfortable discussing it, or yes, I get asked, but I don't always feel equipped to help. And truthfully, I think that, this is something that whether, we want to or not, we're going to encounter in practices, because patients are consumers and they are out in the world and they are reading about this stuff and learning about it. And we as providers of, of medicine and menopause medicine, need to sort of understand what they're asking us at a bare minimum, right? And so that's why I think today's talk is so important and so vital. So I really appreciate your guys' interest in it as well. And then that's one poll I wanted to ask. The second one I'm going to throw up, this is more sort of a quiz. Okay. So what percentage of women of midlife age in a survey done were found to use some form of complementary or alternative medicine, just in general? Like, what percentage of women do you guys think this is actually happening with in real life? So I'm going to launch that so you can answer. That would be helpful. There you go. Go ahead and click where you think. Yeah. So these are interesting answers. What do you think, Anna?
I know the answer. So.
You know the answer. Yes, you do know the answer. Okay. Well, the truth is that it is actually greater than 50%, right? Am I correct, Anna? Is that true?
You are totally correct.
Yeah.
Yes.
So that's a lot, you guys. That's not a small group of people. So we really do need, this is already happening, whether, we're handing these patients advice or not, they are finding it on their own. And it's much better for us to be informed than for us to be left in the dark here. So
and the thing I would add there, Jackie, is sometimes we underestimate that number because patients often won't tell us that they are using certain other modalities. Sometimes they don't tell us for fear that they assume that we may be against it, or they may assume, often rightly, that we just don't know much about it. So I think our perception from information that's disclosed will often underestimate the use of these complementary modalities.
Yes, that is 100%. I think people feel like it doesn't apply, to the doctor's visit sometimes, or maybe they just don't think that their doctor would understand. So I always ask, now what medications and supplements do you take? Because people will be like, oh, I don't take anything. And then they have, 7 things that they're taking, but they just didn't consider it as medication. So it didn't get brought up. So yeah, so that's, going to lead us right into our case today. So this is, a synopsis of it. I'll try to go through it quick because hopefully you guys all had a chance to think about it. So this patient is 52. And she is now 1 year her last menstrual period. So officially postmenopausal, technically still, that first year after the last period is technically part of perimenopause. So this is still within that window sort of that we see a lot of symptoms, and she's experiencing those. So she's having progressive, frequent vasomotor symptoms. So hot flashes, night sweats, they're, impacting her at home and at work. And she is having issues with sleep. She's having trouble dealing with stress in general. She feels like she can't handle everything that's going on in her life. And it's affecting her relationship as well. She's experiencing vaginal dryness, and that's causing pain and anxiety and causing difficulty in her relationship. Just to keep it simple, her GYN and medical history are mostly uncomplicated. She does have a family history of breast cancer, which, she watched her mother have breast cancer at age 60, and that was traumatizing for her. So she was also told by her previous doctor that hormones would give her cancer. She has a family history. She's just not a great candidate, going to give her cancer, and she just wants to avoid any and all hormonal therapy. So what does she do? So she goes to an alternative doctor, quote unquote, and told she had adrenal exhaustion. Okay, we'll talk a little bit about what that even means. And started on an energy supplement purchased directly from that provider, and has been taking it now for 3 months, maybe not feeling that great. Some tiny improvements, we're not really sure. She brings this bottle to you of what she's taking, and you look at it and it says bovine adrenal extract with no other details. It's a white label, private label, and you have no idea where it really was made or how it was created. So that's one thing. And then she's also been reading, or maybe she heard from a friend who did a laser treatment for vaginal dryness. And she specifically looked it up and found it was Mona Lisa Touch. And so she wants you to tell her all about that and, to help her solve her problems of menopause without any hormones whatsoever. Right. So no small feat. So to begin, Anna, so I think we could go a lot of different directions with this, right? We could, try to convince her that maybe hormones are not necessarily going to give her cancer and maybe reframe some of her cancer risk for her. We could talk about the difference between systemic hormone replacement therapy and local vaginal hormone replacement therapy, and why, if she doesn't want to use systemic hormone, she could use local vaginal ones. So those are all, ways we could go. And that's probably what you and I would do in practice if this person actually came to us. But for the purposes of today, let's just say this woman is like a hard no matter, I don't even want to hear the word hormones. Let's just take that off the table, right? So when you see this and you are approaching this patient, what are some of the things that you are thinking about in terms of how to advise her on non-hormonal treatments and supplements for her specific symptoms?
And Jackie, are you asking me, or are we asking the audience first?
Well, let's ask the audience. And again, use the chat. You guys can just, just pop in some things that you come to mind, like what's wrong with this scenario, right? Like what are some course correcting actions that we need to take right off the bat to kind of reframe the non-hormonal approach for this patient, whether it's a supplement recommendation or, like I said, a cancer recommendation, but what are some things that you think you would say to this patient? And don't be shy. There's no wrong answers here. Any thoughts? Thank you, Kathy. Yes, the bovine extract is probably not a great idea. And one size does not fit all. That is true. And we did not talk about blood work. You are absolutely correct. However, this patient is officially postmenopausal and of the typical postmenopausal age and pretty symptomatic of things that are typical of menopause. So technically we could go ahead and treat her without doing blood work, but certainly, as you all know, patients come in and ask for blood work. And she does have she doesn't have a complicated medical history. So we're going to just pretend that all her blood work is normal.
Yeah, I would add to that, I think often we're, patients come to us for a specific reason because they think or they know that we may be the appropriate specialist. And even in a patient like this, whose symptoms are kind of screaming menopause, I think it's always worthwhile to take a step back and really kind of assess the whole person. I think we tend to kind of look at things from the angle of our own training and our own specialty. And even in a, menopausal patient with some hot flashes, with sleep disturbance, with loss of energy, with maybe libido and vaginal dryness, not all of those may be due to just low estrogen and progesterone. Like we do need, I think certainly in a patient like this, I would not be opposed to doing some blood work to assess her hormonal status, to look at her thyroid function, for example. If we're dealing with something like fatigue, for example, look at her B12 status and so on. And certainly, and I think people are really putting this in now, absolutely, Kathy, I agree, cortisol, blood sugar issues, assessing not just the numbers, but also more from a more holistic perspective, her history, and her lifestyle, right? We all know that there are triggers for poor sleep. There are triggers for vasomotor symptoms. What exactly is happening in her life? So I would certainly start there, kind of go back to the drawing board rather than assuming that everything is menopause.
Yeah, it's so easy to just blame it on menopause, right? And a lot of time it is menopause, but there's also many other factors that, weave in and out of menopause that can be corrected, that have nothing to do with hormones, that in the traditional sense of the way we think about that.
Right.
So that's an
Or,
excellent.
or that accompany the hormonal change of menopause, things like insulin resistance, things like increased cortisol, things like lower testosterone, and so on.
Exactly. Yeah. And to be, truth be told, there are plenty of patients who this is a black and white case in terms of how she thinks about it. But I see lots of patients who come to me and they're like not anti-hormones, but maybe they just want to start with something simple or what they perceive as simple or, non-pharmaceutical to see how it goes. And there's nothing wrong with that. You're partnering with these patients. They are going to be coming back to see you, in several months to sort of reassess what we're doing. Is it working? And so it's not unreasonable at all, depending on the severity of her symptoms, as long as you're talking about, what treatments are available and kind of how you would stage them, to start with some supplements and see how it goes. Many people find adequate relief and they feel just fine. And they're, happy that they didn't have to go into the whole hormones, replacement therapy realm. And that's all that was needed, and great, win-win. But for the purposes of this case, I think we're just going to take hormones off the table and kind of talk a little bit about supplements and other integrative approaches. And I know, Anna, you think about it this way too, but supplements in sort of boxes, right? There's supplements that help kind of with a variety of symptoms that maybe we use because we know they're pretty safe with few risks, and that can be really helpful. And so that we think about like a box of supplements there. And then I also always think about, okay, what specific symptoms, what top symptoms is this patient coming to me with that need addressing? And what are some possible supplements that, check those boxes? As you guys probably know, supplements come, as single ingredient, and many patients are coming on combined ingredients. So, 4 or 5 different things for, sleep or, just categorized broadly. And so it's really important that if your patients are already on this stuff, that they bring them to you if you can get the actual bottle, so you can actually see what is in what they are taking, because so many times patients are double dosing in different ways. And so I always encourage my patients to bring in their bottles or take pictures of them and send them to us.
Yeah, what I would add here is, when I think about supplements for menopausal symptoms specifically, I also divide them sort of into categories. And like you said, Jackie, there are some that will apply to a number of different symptoms. There are some that are symptom specific, but it's also important to think of them as supplements that may have hormone-like effects or will affect hormones directly. For example, some phytoestrogens that may have weak estrogenic activity, or supplements that actually, this is especially true, not for this patient, but somebody in early perimenopause, supplements that will help perhaps metabolize excess estrogen that we see often in early perimenopause. But there are also supplements that are actually hormones, and people are sometimes led to believe that they are taking a natural agent or an herb or something that's not really hormonal, and they are taking hormones. This patient is taking this bovine adrenal extract. By the way, this is actually a true case of someone that we've seen who was taking this adrenal extract composed, so this is a cow adrenal extract composed of, ground up adrenal glands that can contain things like DHEA, that can contain androgens, that those two agents can then convert into a more estrogenic compounds in the body. So I worry about these products. Some of them are quite unregulated. Many of them are sold directly in providers' offices. Many of them will not have specific ingredients listed and will just have a proprietary blend. So just as a rule, we, for example, don't use adrenal extracts in practice. There are other ways to address adrenal function with adaptogens and more of an herbal preparation rather than directly ground up adrenal gland. I think we're all familiar, for example, with Cytomel, which is thyroid extract, which is quite regulated, and we follow people's thyroid levels for that. That is not the case with the adrenal extract. So I think that's venturing into that territory can sometimes open our patients up to unnecessary risk. So
Yeah.
agree with Grace, because that she would recommend going off the bovine extract.
Yes, because you're right. That is definitely DHEA. I think we are one of the only countries where DHEA is not, given by prescription. That we can actually get DHEA even over the counter is pretty strange, considering how many things are regulated in this country.
Yeah, and especially since DHEA can convert both to testosterone and through peripheral conversions to estrogen, I think that's a pretty for this particular patient who does not want hormones, this would be a no.
Yeah. So I guess let's talk a little bit more specifically about the symptoms and how you think about, vasomotor symptoms. And you talked a little bit about phytoestrogens, but I know, you've always taught me that there's sort of like different, like a tier, in terms of like how estrogenic something is. And when we think about supplements, you kind of want to think, where do you want the patient to be, and what are the kind of the different types of estrogen mimicking supplements that are out there? If you could, briefly, I know it's a lot, but if you could briefly kind of like think through that for us.
Yeah, so even in this group, I think we could consider supplements that are non-estrogenic at all, that have shown efficacy, for example, for things like vasomotor symptoms or vaginal dryness even. Which would be safe from the perspective of any cancer risks, especially in somebody who may be concerned about breast cancer, and supplements that may be even safe in actually breast cancer patients, versus phytoestrogens. So we know that hormone replacement, for example, will treat menopausal symptoms at their root cause. Supplements work somewhat differently, especially those that are non-estrogenic. So in that group of non-phytoestrogens, we're going to encounter some supplements that when taken systemically, so really as sort of capsules or pills or teas and so on, may help with things like vasomotor symptoms or sleep. The data on libido, for example, is somewhat weaker. But in that non-estrogenic group, we're going to find things like Swedish flower pollen extract that goes under, I think it's a pretty well-known product, and that goes under the name of Relizen. There is some data on vitamin B6 also. Then we move into supplements that may, and I'm sorry, I'll add one more to that is more useful for sleep and mood disturbance rather than vasomotor symptoms, and that's saffron. The studies on that are pretty good, so we are using this currently for those complaints. It's been studied especially in perimenopause, so maybe a little bit earlier than where this patient is. In the sort of controversial area, we have soy and soy isoflavones. Those have some extensive data behind them showing improvement in vasomotor symptoms. And then we move on to things that are more clearly estrogenic in the phytoestrogen realm. For example, things like black cohosh and red clover. They have mixed studies behind them. There are occasional reports of toxicity, also quite rare, but there are. So even in patients that are quite open to phytoestrogens, that don't have any contraindications to them, I certainly tend to use either the Swedish flower pollen, soy isoflavones, for example, in them. And I would also add here that we're talking about these integrative approaches, and supplements or stuff we take is just one arm of that. So, and we will get into other things like lifestyle modification, acupuncture, hypnosis. Those are really, really important. So I do want to stress that integrative approach does not mean just stuff we swallow that's not medication.
Oh my God, that's such an excellent point because it does. We always think like supplements and integrative med, it's the same thing. And it's
Right.
really so much about the lifestyle stuff, right? So let's also kind of touch a little bit on sleep. Sleep is super multifactorial. Sleep is not all about hormones, but hormones definitely impact sleep. And we know that sleep is vital and is such a big issue for so many women who are going through menopause. So when you're thinking about somebody in this scenario, Anna, who is having trouble sleeping, taking an integrative approach to her sleep, what are some things you typically like to recommend?
So, for sleep, and again, kind of following that integrative mindset, it's important to first assess the type of sleep disturbance someone is having, potential triggers for that. A lot of women will self-medicate with alcohol or over-the-counter medications for that. So I think it's very important to kind of dig deeper when we see our patients. Certainly starting with lifestyle things like sleep habits, sleep hygiene, turning down your temperature, having a quiet room, turning off those screens before, really making sure that we really dial down on alcohol use. Looking at someone's diet to make sure they are not kind of oscillating between high blood sugar, low blood sugar all the time, looking at their stress level and ways that they can decrease stress. These are all super important. From a supplement perspective, there are a couple of things that we use quite frequently in this realm. Starting with something that's quite safe, like magnesium, for example, and here it's important to know magnesium types. There are, one of our favorites is ashwagandha. This is an product that really has a lot of extensive data behind it, particularly for sleep and even vasomotor symptoms. It will not do anything for vaginal dryness, but certainly for those more systemic symptoms will be may improve with that. So I would say magnesium, ashwagandha for sleep. Certainly we can add things like melatonin. It's important to know that 15% of people can have really terrible dreams with melatonin. So I usually warn my patients about that because it's not for everyone. Typically start a low 1.5, 3 milligrams and go up to about 6 milligrams from there. And then there's a smattering of other things for sleep, including things like hops and even chamomile tea. They're going to be more of anxiolytics than actually sleep promoters. There is more data coming out about CBD, but it's still pretty sparse out there. Quite a bit about CBD and anxiety rather than sleep, but some people do report improvement from that.
Yeah, thank you. I was going to ask about CBD because definitely everyone's trying that for whatever thing, they want.
Yes, for anything and everything.
Anything and everything. And it's pretty harmless, but it is, like you said, important that you look at these bottles, know, what are good manufacturers? Are they third-party tested? You want the quality assurance. The brand does matter. So let's briefly touch on laser treatment or non-hormonal treatments for vaginal dryness really quickly. We can do a lot without hormones vaginally. Definitely a vaginal moisturizer, right? Something with hyaluronic acid, which is in a lot of skincare products in general, is an excellent, there's great data to say that works quite well, especially when we're talking about early vaginal dryness, right? When you're just starting to feel like you're less lubricated, maybe sex is just starting to be a little bit uncomfortable, that sandpaper feeling that we hear about in practice. Somebody can certainly start with hyaluronic acid suppositories, very effective and an easy place to start. Of course, that is different than lube with sex, right? There's lots of different lubes on the market. So I always ask my patient, what lube are you using? Some of them are like, what do you even mean? Or I get it at CVS, and we can do better than the CVS lubes, right? So we'll probably do another talk on sexual, medicine and menopause in a future session. So I won't go into too much detail. But definitely, like, these lasers, they are out there. We certainly use them in practice. There are starting to be some studies We did, unfortunately, there was a study that showed that the Mona Lisa on a CO2 fractionated laser was not potentially as effective as we thought it was. And there's some conflicting information or it's conflicting thought about why the study turned out that way. But Anna, what is your personal opinion about lasers for dryness and for DSM, as we say?
Yeah, I can tell you that the data behind them is confusing because some studies show definite improvement, some studies depending, and I think the one you're talking about, Jackie, came out in just in the last year, showed no improvement at 6 months. Which I my comment about that study is like it kind of tried to find improvement 6 months after therapy. It's sort of like trying to see if your nails are still colored red 6 months after a manicure, so I think it's probably the endpoint was too far out in the future because we don't know. Right now, lasers are recommended to be repeated once a year, but that might need to be moved up. There are other studies that do show improvement immediately after and at the 3-month point. And honestly, I do think in my personal practice, I do find that they are effective. And especially for women that really have either do not want to use topical hormones or really cannot use them. And I'll say here that topical vaginal hormones are quite safe, and most even breast cancer patients are okay using them, and their oncologist will give them the green light for that. But if there is a patient that just simply doesn't want to use them or really cannot use it, I do think that the vaginal lasers can be helpful for them.
Yeah, and I do always I use lasers a lot in my practice as well. And I do always encourage patients when they can to use them as sort of part of a multimodal approach. So I always say the lasers are going to be helpful, but they're also going to be helpful if you do other, these other XYZ things. And so, I think when we're studying lasers, we need to like look at them, in terms of the whole depth and breadth of the patient's, clinical trajectory. So I do want to say,
I would even add here that, and this is not based on, prospective randomized trials, but I do find in clinical practice that women who do a, 2-3 months of pretreatment with topical hormonal therapy actually do better with the laser than someone who, has been in menopause for 10 years and then now is showing up for laser therapy.
Absolutely. So let's let Kathy come on. If you're listening, Kathy, if you can unmute and turn your, thank you. There you are. It's so good to see you. Welcome.
Hi. Thank you.
And if you can just kind of talk us through. So this patient, comes to your office and she's been, referred by me, your neighbor next door, for acupuncture and, to kind of pick your brain about what other things you might suggest. What kinds of, approach do you take here?
So, thank you. Thrilled to be here with all these colleagues tonight. I'm going to try to stay in that lane of just acupuncture because we were able to find enough clinical research that shows high efficacy, right? But the traditional Chinese medicine approach is not only needles, it's all of this lifestyle stuff, and definitely white label, bovine something. I don't even know what's in that. So it's not they can tell me what's in it, but I'm not sure what's in it. But number one, we'd be looking at how are they sleeping, how are they eating, believe it or not, how are they moving their bowels. The application for acupuncture, and I don't know if anybody on this call has ever had acupuncture, so I would just like to know that. Can everybody say either yay or nay? And the only reason I'm saying that is because it's very foreign to people who have never experienced it. But when I see a patient for the first time, we do an entire intake of what their lifestyle is, what their medical history has been about. And a lot of the things that are in this particular case study today shows up in my office daily. And what the conversation that I really have is, what are you willing to make some shifts about? Because this is really a time for reorganizing how we're thinking about how we go through life and do Soul Cycle 7 days a week or do CrossFit. So I know I'm not answering your question directly, Jackie, but this is really what the experience would be about. So we bring a different perspective to the table. So I don't know how many, oh, okay, so that's Ludrina. Okay. So I wasn't watching the chat. Acupuncture between 6 and 8 visits on a weekly basis. Uh, it's not no, not dry needling. Um, so why? Because the acupuncture, we know one of its mechanisms of action is just to start a biochemical bath for your brain. What is that? Uptake of serotonin. There's dopamine. There's oxytocin. Within 20 minutes after your needles are inserted into the body, you're lying there kind of chillaxing, and already changes through the healing cascade are occurring. So the body is the healer in our room. The body has its magnificence. And then we take one part at a time and we go, all right, you're never going to get better or go through this transition period if you're very stressed out, and you're stressed out because you can't sleep. And you can't sleep because maybe these lifestyle issues need a little bit of a change. So that's how we start. I'm not sure that's really directly helpful. I'm trying to look at the things. Yes, I would do at least 6 to 8, usually 2 cycles of either somebody in perimenopause, and we're trying to get to women at an earlier age. And that's a lot of my outreach in my community. We need to start talking about this before your body's having all its messengers out on fire. You need to begin to be making shifts. And so everything that Dr. Barbieri already talked about is certainly part of the packaging that I would suggest as well. What we have found is black cohosh works better in perimenopause than in late stages, and that's just my clinical thing. And of course, we have a lot of Chinese herbal medicine that is individualized. When not chasing symptoms, we're looking at an underlying pattern of behavior that the body demonstrates.
Yeah. And I think it's so like important to say, Kathy, too, that like we need, women need to hear this sometimes multiple times from multiple people. So they might hear from their GYN, but then when
Yes.
when they show up in your office and you're echoing those same things, it really takes, almost like beating people over the head with it to really sometimes move the needle, no pun intended, on what the things are that need to truly happen in order to feel better through this transition. Because while hormones are powerful, they are not the end all be all, and they won't make a difference if somebody isn't doing the basic fundamental things that are, vital to just good foundations for health that will carry them through to the second half of essentially their life. We live at half to a third of our life post reproductive years. And so how do we want that to look, and what do we want that to feel like? And our body, we have to start to think about our body as as something that should be the recipient of the same kind of care that you provided to all the other people in your life, during your reproductive years as well.
That's right. And there is like this little shift of, I just want to take these pills and these supplements, but it's not going to help you. It's not going to sustain that. But I just saw a notice here from Susan. Right. So the cost prohibitive thing is that it's not going to be covered by insurance, typically for vasomotor symptoms, but that's insurance dependent. So we're not going to say that's across the board, because I have some patients who come in for a toenail and their insurance covers it. But more importantly, if that's a 6 to 8 week commitment of something that can actually, in conjunction with everything else they're doing, move the needle, that's a good investment in a new foundation of health. And I think sometimes the response I hear is, well, if it's not covered by insurance, I'm not coming. I'm not here to argue that or to platform for it, because I'm not the one suffering. You know what I mean? So if that's how they have to make the decision, that's their decision. Yes.
I will add something to that. I think, I think as women's health practitioners, and especially as integrative practitioners, we both ourselves and our patients, we need to get away from the current paradigm of medical care, which is I have this and you give me something or do something to me to make me feel better. That with something like perimenopause, menopause, or really any sort of And I wouldn't want to medicalize menopause. It's a normal transition, but this will apply to really a lot of the chronic conditions that we have and our patients have. We really need to change that paradigm. Our patients need to become really invested in, both time-wise and even sometimes financially, in their own care. Otherwise, no matter what we do, whether it's a prescription for estrogen or a bottle of Ralizan or sticking needles in somebody, if that person will, expect the world to change just because if something is done to them, it's not going to work. There's so much of the perimenopausal transition and how we go through it that's dependent on our lifestyle, on how we live every day, on what we eat, on how we sleep, or how we think of aging even, that this other stuff is just another part of it, but it's not central to it. So I really want to stress that an integrative approach really turns the medical paradigm around. It puts the patient at the center. The patient has to be a real partner in their health with us.
Yeah, and that's such a good point.
The best point.
Yeah, it really, and to the point about, it not being covered, sometimes I find that the patients who have to pay for something, like you said, Anna, they're a little bit more accountable and they're a little bit more invested in the outcome than if something is like, just, okay, like I'm show up, fix my problem, I'm going to go home, and everything's going to be great. Menopause doesn't work that way. And, sometimes it's going to take months to years to really truly get a hold of this stuff. And I think that we need to frame those expectations from the time that somebody walks into our office. I mean, the hardest part about, healthcare during this phase is that most of it happens outside of the office visit, right? We're just there. We're just an inflection point, a moment in time to capture somebody's attention. Then they go back into the world and like life happens, and we're on our social media and every all the garbage that's gone on this past week. Like we're all just consumed by a million other things that raise our cortisol levels and bring us right back down to where we were. So certainly, at Elektra Health, that's part of what we aim to do, is to be, sort of an accountability partner for your patients when they leave your office, because we know that that is how the work gets done. We need to be accountable to somebody in a non-judgmental, evidence-based, like real way where we get women and we have their trust. And we are a partner to providers like everyone here on this call who is seeing these patients and giving excellent care and saying all the right things. But when that patient leaves your office, they're going to go back to do all the things that they were doing, not because they don't want to or they're bad people, just because it's hard work. And so I think that, if we're going to help women, it is going to be a collaborative approach with conventional medicine, with integrative medicine, with lifestyle, with educating women, empowering women. If you're empowering a woman, ultimately, she is the one driving her care, as Anna and Kathy mentioned. And just to, again, let you guys know that if you are interested in collaborating with Elektra Health as providers, it doesn't cost anything for you guys to join our preferred network. You join our network and you're going to get your patients a super steep discount on our program called Metamorphosis, which is nurse-led menopause experts, taking what you guys have taught your patients in the office and continuing it with them as they go home, that back and forth. We're here to, be part of the continuum of care. So I really encourage you to take advantage of, these discounts that are available, because again, patients are, unfortunately, insurance isn't, going to cover a lot of this stuff, but when we make it cost effective for somebody and they're invested in their care, both mentally and financially, sometimes that's what it takes. And that's, patients are finding that, they're really glad that there's somebody who they can listen, who will just listen, right? That they can just like come onto Elektra's platform and, get the ear of one of our guides, and they can just let it all out and tell them, what happened that day. And sometimes that's the therapy. That's the thing that was, so needed. And we become their trusted partner in care. You have to earn that. It isn't just given. At least I've found that to be the case. So if anybody has questions, it's 8:45, so we'd certainly stay on, but I want to make sure you guys have time to get your questions answered about menopause supplements, about integrative stuff, acupuncture, Chinese medicine. Now is a great time to put it in the chat. But, and also we are going to be, these are once a month events that we're so, we're so excited about. And I really appreciate everybody coming tonight and really participating, but we want to be able to connect with you all in between these monthly sessions. So you all be getting an email as always after this event with just how did we do? What do you want to hear about next time? But also there's going to be a link to, I don't know if you guys are familiar with Slack, but it is a way for us all to get together in one sort of portal, one community that's off of Facebook, that's completely, like private and professional, where we can actually, actually talk about de-identified menopause cases like the one tonight in a professional environment, know that it's being moderated and looked over by somebody who follows evidence-based medicine. But also, honestly, I really want to create a space for us as NPs, PAs, acupuncturists, social workers, and, pelvic floor PTs, anyone who's putting their hands on a patient in this phase of their life, to be able to talk about also the professional issues around that, getting certified in NAMs. How do we do that? What do I deserve to be paid? Like all those things that you want to ask your best friends at work. I want to create a space that's safe and is good for everybody to feel comfortable coming, again, non-judgmental, but also academic and also evidence-based. And I'm hoping that we can do that. So please, again, totally free to join. I know you guys are in probably a million communities, but Facebook isn't always the best place to talk about this stuff. So I'm hoping we can do it as part of the Elektra community and get to know each other a little bit better in between these sessions, as well as during our time here together. So thank you guys for listening to us. I definitely want to hear what you want to hear about going forward. Definitely think sexual medicine and, definitely menopause after breast cancer. Those are two topics that I think we've heard are of interest. I think early menopause is something that, needs some education around it for all of us. And so those are things that I'm thinking, but really, truly, this is for you. So speak up, put it in the chat, email me, hello@Elektra Health. Look out for that Slack channel, and we look forward to more time together next month. Anything else anyone wants to say before we go? Thank you, Kathy. Thank you, Anna.
Thanks, Jackie, and thanks, Kathy. And wishing all of you a great rest of the week, and reach back out to us.
Yeah, we want to hear from you. All right. Have a great night, everybody.
Good night. Thank
Thanks
you.
to you all.
Good night.